the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, welcome to the May meeting of the Radnor Township Board of Health. Just for the clarity of anybody who is watching at home, we have a couple of things going on here. So our board chair, Chloe, is in attendance but is not able to chair this evening. So as the vice chair, I will be chairing this evening. Additionally, we have two members who are joining us remotely. At the present time, as far as we are aware, 4 members does constitute a quorum. Because we are unclear if an additional member has been appointed. If an additional member has been appointed, that would mean 5 would be a quorum. So we are holding the meeting, but out of an abundance of caution, we will not be taking a vote on the minutes tonight, since that would potentially need to be redone if we were incorrect about the number needed for a quorum. So with that said, we're going to skip over the review and approval of the minutes for this evening. The next agenda item that we had listed was organizational issues and important health dates. For organizational issues, I will just ask all board members to, again, check their calendars, because we do have, I believe, exactly half of our meetings for the year, even though we're theoretically scheduled every Monday. I believe half of our meetings are occurring on Tuesdays this year. So just everybody, please be aware of that. Babby, did you, or Melissa, did either of you have anything to add in terms of health dates for the month?
I don't myself tonight.
Okay. Melissa?
No, me either.
Okay. The next item on our agenda is the communicable disease update.
I mean, we could talk about respiratory viruses in the county are very low. Everything, of course, as we would expect for respiratory viruses, is low. Very low, actually, in the county. So influenza, RSV, pertussis, all very low at this time. There's been a lot of talk about the hantavirus, and that is a very low risk in the United States, spread by the urine. People can get infected with virus particles from rodent urine, droppings, nesting material, becoming airborne. It's a rare to, it's not spread easily, and ways of getting it would be sweeping or vacuuming rodent droppings. If you see areas with a lot of rodents, you want to keep clear of that. But the risk in the United States is very low. Do you have anything to add to that? I know Ebola is coming onto the scene, but we'll just wait on that one.
Well, hopefully that not with Ebola, but we'll definitely keep an eye on it. I would just add, in terms of the hantavirus, that for people to be aware of the media coverage. Actually, there are a few comedians who have done some actually pretty good coverage of the fact that a lot of the news channels, the experts they're bringing on, are saying, are kind of keeping the expectations about how nervous everybody should be sort of realistic, and then they cut back to the anchor, kind of stoking fears about things, because that's a person who's maybe got a little more invested in the viewership numbers than the accuracy. So just kind of keep that in mind with the media coverage around that particular disease.
I would concur with that completely.
All right.
And I would just add, one more thing around the tick bites because it's that time of the season, right, with Lyme disease.
Mhm.
So just for people to dress kind of defensively there, wear light color clothing, tuck in your clothing, wear your socks high, check your body immediately upon returning indoors, check your pets because they do carry ticks usually in and out of the house. And of course, you can apply repellent. And if you don't want to do repellent, there's like oil and lemon scents that you can use that could potentially help as well.
If you are bitten by a tick and you have any concerns, of course, you can see your PCP or urgent care. I do believe now we have gone back to prophylactically treating with doxycycline. I know we've gone back to that, so that's an option as well.
All right. Anything else under communicable disease before we move on? All right. So with that, we will move on to updates on the student intern program.
Hi, I know Haley's also trying to join on Zoom, but she couldn't find the link. I'm not sure if you want, I can just tell her it's fine, or...
Ian can send Haley the link.
Yeah, I mean, I have her email. I mean, she can just, I can read her update if you want, but for me, I'm just finishing up my presentation, which includes research, a potential project plan, and the plan for the Family Health History Awareness Project that would be the proposal for the township to implement. And I will ask Haley for hers, or I can get the link and send it to her. But just for me, finishing out the presentation that I'm planning to present next month, I think.
Mm-hmm.
Yeah.
Yeah, students are next month. I do believe that's presentation.
Yes. So, and with that in mind, I would just encourage all of our board members to, obviously we all want to try to make as many meetings as possible, but next month sort of being especially critical that we want to have a quorum so that our students can do their presentations. And then, so do you want to read Haley's update? Or? Oh, okay.
I don't have hers. I'll ask her for it, but
okay.
yeah.
If you can either
I can also put it in the minutes.
Email her the link or tell her that however you want to do it. We can always circle back and reopen that agenda item before the meeting ends if there's anything to do there.
Okay.
All right. The next agenda item is old business. I don't see anything listed under old business. I'm not aware of any particular standing items that aren't listed. Our next agenda item is new business. Our first there is the RTSD update, but at this time, I don't believe we've been joined by our school district liaison, so I think we're just going to hold off on that for now. Same with Board of Commissioners updates. I don't believe we had anything from Maggie. County updates, I can just very briefly say that the county is still doing the immunization clinics, the STD clinics, and also offering some CPR classes. So some things to check out for anybody who wants to make use of our county health department. In terms of food inspections, we had one inspection that was, complaint-based in the past month. We did have 4 establishments that actually got perfect reports, which is relatively difficult to do, so well done to them. That was Conestoga Swim Club, I apologize if I'm mispronouncing this, but D. Innocenzo's Bakery, Country Twist and the canteen at Cytokinetics F300. All didn't have a single thing noted on their inspection reports, so well done to all of them. The one complaint-based inspection that we did have did address all of their risk factor interventions on their follow-up visit 3 days later. So as far as anything's concerned, that is basically taken care of at this time. They did have 2 repeat violations, but that was down from 9 risk factor interventions. So there was improvement on the follow-up visit, which is the most important thing we're looking for on those follow-up visits. That is all I have on county updates. Did anybody else have anything on either the county or the school district?
I think being a voting night, it's
Yes.
quiet right now.
Okay, the new food pyramid. So I had put that on and then was not really able to be in attendance for the last couple of meetings. So it's no longer quite as new as it was when we initially put it on the agenda. But I did want to talk about it because we do have a new food pyramid. I think in terms of sort of one of the earlier things that students learn in their health classes is probably the food pyramid, which hasn't actually been a pyramid for a little while. It had been a plate for, I believe, about 10 years or something like that. Now we're back to a pyramid, and it's an upside-down pyramid. So I wanted to just take a second to talk about this. So there are 2 things that actually happened here. There's the pyramid itself, and then there are the underlying guidelines that accompanied the pyramid. I'll open this up to discussion after I give sort of my 2 cents on this. So the image that we got in terms of the actual pyramid, I think, has some problems. We're taught to read top to bottom, left to right, and the top left is a big, juicy, raw steak. Right next to it, there's a container of some red burger meat, a slice of cheese, what is either a whole chicken or a whole turkey, which is a little confusing in terms of the portion sizes that is kind of implying. In terms of the protein that is there, it's a lot of dairy and a lot of meat and not so much in terms of nuts and some other things. There is a big stick of butter in the pyramid. Steak and butter has not really been considered part of a healthy diet for a long time.
It can be. Grass-fed beef, we know now. Even the cardiologists are switching on that. We know now
Yes.
that it has quite a bit of benefit to it. So I think the way that we're viewing it, more like a Mediterranean. Like, we know that it's healthier to eat healthy, lean proteins via fish, poultry, beef, grass-fed if we can, organic if we can. Whole butter we're looking at that differently. Olive oil, we're looking at the seed oils. The seed oils not very. The seed oils used to be highly thought of on the pyramid chart, and we are basically not looking at those very well. We don't want to have canola oil or sunflower oil or things like that. We don't want to be cooking with that as much as we do olive oil. We're going back to more whole foods.
Mm-hmm.
I think basically, if you wanted to round up what they're trying to do, it looks like they're saying eat real food as opposed to processed food and grains, things that grow in nature and that, are accessed through nature as opposed to things that are more processed. Before, grains and cereals used to take up a wide portion of the food pyramid, that's been flipped upside down.
Yes, and with the emphasis being on whole grains within the grains. So, and that's sort of what I wanted to talk about is, so I think the imagery, I would have some criticisms of in terms of the actual guidelines. If you look at the written guidelines, which is not what as many people focus on, I sort of hesitate because I think there are so many problems with what, RFK Jr. has advocated for in terms of other things. But in terms of the dietary guidelines that were put out, I think it's pretty hard to look at the underlying guidelines and say that they weren't an improvement over the previous set of guidelines. We had a specific recommendation for the first time that grains should all be whole grains as opposed to the previous guidelines that said to try to do half. We had a specific endorsement for the first time of probiotics, of eating yogurt and other healthy bacterias. We had for the first time an explicit endorsement really of healthy fats.
Very important. Avocado fat.
Right, avocado, olive oil, those things. We had for the first time, as far as I'm aware, a really explicit endorsement of no added sugar, which is a big difference from the previous guidelines, which had endorsed fruit juice, which, as with anything else, fine once in a while. But the reality of fruit juice is that despite the healthy image, it's basically sugar water.
Empty calories, a lot of empty calories, a lot of sugar.
Yeah. So, so I would encourage people. I know that the pyramid is, the thing that grabbed a lot of attention, but I would encourage people to look at the actual guidelines because I do think we got some good improvement there. And in terms of the actual message of eating real food, I do think that is a good message. So so that's what I had to say about the new food pyramid and the new guidelines.
Yeah, I would say overall, it really focuses on eat whole foods, real foods, and limit processed foods. Things, if it's growing in nature, something that is naturally occurring, those are things that we want to go towards. Vegetables, fruits, nuts. I think even though it's misleading on the chart, still advocating for nuts. Eggs, I feel like eggs got a really bad rap for a very long time, and I think it's as long as you're eating maybe pasture-raised organic eggs, they have a lot of benefit. We know that. And we're not even really looking so much at cholesterol. We're looking at studies now that are debunking some of that. Eating an egg every day does not necessarily mean a high cholesterol. So as people are taking other looks at statins now and whatnot, we're seeing a lot of that going on. But basically, lean proteins, nuts, vegetables, fruits, the majority of your plate. And the lesser portion of your plate would be grains and cereals, things like that.
Melissa, did you want to add anything?
No, I mean, I was just going to say it's all about the balance, right? And picking those lean proteins. And again, they're high caloric intake. So just being cognizant of the fact that in the picture, it may look like you need to eat a whole chicken, but in reality, again, portion size.
Yeah, I think
because with these proteins come the excess saturated fats and increase in cardiovascular disease. So, again, it's all about balance.
Right, I think they're looking at healthy fats now. They're looking at healthy fats. It's like in the whole grain picture. You're not going to eat a whole loaf of bread. There's a whole loaf of bread there.
Right.
They're showing people the categories. They're not showing people the portion sizes.
Right. Well, I do, and again, that was my kind of comment, is I do think that, it does get confusing when you look at, a whole chicken versus a slice of cheese and then a half an avocado and but if you look at the actual, like I said, if you look at the actual written guidelines, the amount of protein that they're
Yes.
encouraging people to eat actually hasn't really changed
That's correct.
substantially.
That's correct.
Which is why, again, I think that it's important, to for people to try, if they can, to not just look at the picture, but also read the actual words. So, yeah. Okay.
I can go back to Haley's. She was trying to get Ian, but I
Okay.
don't know where Ian went to
Sure.
send her the link.
I also have her
Oh,
update if you
okay.
want me to.
All right.
Yeah.
Thank you, Simone.
Haley says that recently she's been working on finalizing her project by organizing her research and completing her PowerPoint final presentation. She's been focusing on bringing everything together and making sure all of the information flows clearly and represents the work that she's done throughout the internship.
Her project is on the relationship between sleep and academic performance in high school students. And she sent me her outline. She's really done a great job. She's interviewed multiple people. She's used a lot of research studies, and it's looking very good.
All right. In terms of new business, I will just add a plug now that this is really our first warmer weather meeting that we've had. It is, we're starting to get warmer, sunnier days, so I'll just put in a plug for the summer. Drink water, sunscreen, sunglasses, keep yourself safe.
And I'm going to add to that. I would say, yes, keep yourself well hydrated, as cool as can be. Wear clothing that's cooling, cottons and linens and things that don't hold on to the sweat. And I would say in terms of sunscreens and things like that, there are apps out there now. I always give my own patients. We have Yuka, which is EUCA or KA, and Bobby approved. You can run your sunscreen products through there to see which ones are the safest ones to use on yourself and on your children, because they're ranked, and we know that the skin is the biggest organ of the body and absorbs basically everything you put on it. So we want to make sure what we're putting on it is healthy and not contraindicated. So I would definitely look into these apps that are very good for food and products.
And also, I said sunscreen, I should also say, even better than sunscreen is also covering up as much as possible and staying in the shade as much as possible. A little bit of sun is good, get some natural vitamin D, but I think that was the only other thing I wanted to add under new business. Babby, Melissa, anything else you want to plug under new business?
I don't think not right now.
I mean, I don't think so. I think the only thing is, if we're talking about summertime, obviously pool safety, water safety with small children, because people are opening their pools now after Memorial Day. Just making sure that it's gated, it's secured, it's locked. I don't know what else to add there.
Don't leave any small
Just
children
for
near the
awareness
pool
on
without
that.
supervision. Yeah.
That is a
Can I
very
put a-
good call out.
I'm going to
Yeah.
put a plug in for pets. Of course, don't leave your pets outside for long periods of time, or of course we don't put them in the car at all. Yeah, so be cognizant of your pets as well and leaving them out in the hot weather.
And actually, I just remembered another one, which was because we did have a presentation a while back when I was on the board for our inclusiveness for handicapped and other mobility challenged residents. So keeping your sidewalks clear if you're a property owner with a sidewalk is a responsibility, not just in the snow time. That also means in spring and summer when your hedges are blooming. Of course, love to see the greenery, but do make sure that everybody's still able to utilize the sidewalk for their walking or wheelchairs as well. Anything else anyone wants to plug under new business? All right. I do not see any members of the public here for public participation, and I don't see any on Zoom. So with that, I will take a motion to adjourn.
Second?
All right. All in favor?
True.
Aye.
Aye.
All right, meeting adjourned.